Well, Victoria's coronavirus death toll is unfortunately likely to rise, with more than 100 staff and patients in 32 aged care homes testing positive. Authorities there now racing to avoid a repeat of Sydney's deadly Newmarch house cluster. Federal Minister for Aged Care, Richard Colbeck, joins us now. Thank you so much, Minister, for your time this morning. 19, as we know, died at Newmarch. It was a terribly tragic place, just one aged care home. You've got 32 homes infected across Victoria. How did you not see it coming?
Well, it's a function of community spread, Carl, unfortunately. The aged care workers are not immune to this virus. In fact, the number is now 39. There were 7 new facilities yesterday that I've been advised of this morning. So it is growing. Fortunately, those new 7 are staff only at this stage. There are 8 facilities where we have residents with outbreaks with the virus, and there are 45 residents in those 8 facilities that have contracted the virus.
In relation
there is more bad news coming.
And we'll get to that in a second. In relation to the Manorock facility, who's in charge there? Are you starting to take control of that facility?
The Aged Care Quality Safety Commissioner, my department, and DHHS are very actively engaged with Manorock. We've moved all bar a couple of the positives out who will be moved today to hospital. The issue there is being able to effectively isolate and separate residents so that they don't spread the virus within the facility, but we are very actively engaged with that facility. I spoke to the Aged Care Quality and Safety Commissioner on Sunday and again yesterday. I've been having twice daily discussions with my department at least, and they are very actively engaged with officials in Victoria as well.
I'm glad you're doing that because I'm not sure that the state has had the capacity to deal with this emergency. Are you aware Manorock was hauled before the Royal Commission into aged care facilities?
Yes, I was aware that
and
they
what was
did
the
appear.
outcome?
Well, they gave evidence with respect to some of the issues that they'd had. I've spoken to the manager of the site myself. I rang her the other night. She's just come out of ICU with COVID, had a very tough time. So this just goes to demonstrate how devastating this virus can be once it gets out into the community. And we're working, as I said, really closely with Victoria. I know Greg was talking to Minister Makakos last night. I had a briefing on that meeting late last night with respect to any of the additional things that we might be able to do in conjunction with New South Wales to help protect aged care facilities across Victoria. And of course, we're talking to New South Wales with the concerns that exist in Western Sydney at the moment, with a visitor that went in that was COVID positive. OK,
I'll get to that too in a second. There's a lot happening. The point is they had a Royal Commission. I know how hard you are working. I know how many calls you're making. I know how across this you are. This is not a criticism of you. But there was a Royal Commission, and this particular facility in Victoria was hauled before the Commission. So we knew what was happening there. They knew they were being watched. What steps were taken at that facility to ensure an underperforming aged care operation would be safe during this pandemic, because we knew it was coming?
Well, it wasn't this facility, Carl, it was the group. It was the Manorock group that appeared before the Royal Commission. Talking to the manager on site, they'd been taking temperature of residents 3 times a day. They'd been practising their PPE drills, donning and doffing, so that they could, if they did have an outbreak, they would be in a circumstance where they could manage it. They've lost most of their staff because all those people who've been doing that work, all that practice, are either COVID positive or isolating and off-site. So the service has been severely impacted in 2 ways. One, a number of residents, at the moment the official number is 15 who have contracted the virus. Unfortunately, one of those has passed away. But they've lost most of their staff because they're either contracted the virus or they are isolating. And so we've got a number of staff in there at a range of levels to make sure that the residents that remain there are being looked after properly. We're having a regular round of testing, so every couple of days we go in and retest everybody because this virus takes a while to incubate. And unfortunately, I can't say that the number that we've got now is the final number because it will take a little time for that to work its way through.
I don't know.
very actively managing the site.
Richard, again, I don't know how anyone has any... You're saying all these things and all these reasons as to why there's no staff. I'm hearing there were staff working at multiple facilities, not just one, but up to 3. There's nurses who have been working not just as nurses, but they've been working in the kitchens to help people out. The people and the residents inside these facilities have been so badly let down by the system, it's unfathomable. We heard from Graham yesterday, a resident stuck inside another home. Now, he was scared. He's terribly upset. He's frightened. He lost a friend of his to this terrible virus. How do you ease the burden and the fears of those people inside those facilities this morning?
Well, that's why we continue to lean on the advice of the AHPPC. That's why on Monday the AHPPC gave us the advice that all aged care workers within the Melbourne metropolitan area plus Mitcham should wear face masks. We put that into force immediately. We then put 4 million masks into Victoria to make sure that we could have that supplied. We spoke to Victoria yesterday, and the conversation last night was that we will extend that out to aged care facilities across Victoria. And we, of course, will then supply the masks from the national stockpile. So we continue to ask ourselves, and we continue to ask the AHPPC and the health officials, what else can we do? What more can we do? And we continue to ask that question because it's important we do everything we possibly can to protect these people who, as we all agree, are extremely vulnerable.
I think you're doing a good job, Richard. I hope that you take more control because these facilities are letting people down. We really appreciate your time today. Thank you so much.
It's really, really tough, Carl.
Yeah,
thank you.
I get it. Ali.